These must address both the B cell deficit and the autoimmune response to cells that express insulin. Cells that express insulin have been obtained through differentiation of stem cells of either embryonic or adult origin, as well as genetically reprogrammed and transdifferentiated cells. Knowledge of the transcription factors that regulate development of the embryonic pancreas has aided the evaluation of different strategies used to obtain beta cells. Clinical trials have used bone marrow-derived mesenchymal stromal cells and umbilical cord blood cells to suppress the immune response in patients with type 1 diabetes. Even though challenges remain, the possibility of an effective stem cell-based therapy for type 1 diabetes is a realistic goal for the foreseeable future. On the screen in front of you is a diagram of the generation of insulin-expressing cells from pluripotent cells. Different differentiation protocols recapitulate the embryological development of beta cells. From the diagram, you can see the reprogramming of fibroblasts and umbilical cord cells into induced pluripotent cells could potentially represent an approach to obtain a renewable and available source of undifferentiated cells that could provide a reliable treatment therapy for type 1 diabetes. The generation of insulin-expressing cells from bone marrow-derived mesenchymal stromal cells remains to be confirmed. However, these cells promote survival and regeneration of beta cells. The diagram now on your screen shows strategies to obtain beta cells from organ-specific stem or progenitor cells. The diagram indicates methods of developing insulin-expressing cells from liver and pancreas sources. The challenge of a successful stem cell-based therapy for the treatment of type 1 diabetes is not only to generate functional beta cells, but also to overcome the immune response both in terms of autoimmunity and rejection of allogeneic tissue. Safe and effective cell-based therapies for immunomodulation are currently under development, and certain approaches have included the intravenous humanized antibodies against CD3, which is part of the T-cell receptor complex. T cells are known to be involved in the pathogenesis of type 1 diabetes. Another major safety issue that must be addressed is related to stem cells and tumorigenesis. The many rounds of replication that these cells undergo before transplantation into patients might lead to the accumulation of chromosomal abnormalities that could potentially be oncogenic. So the question is, which stem cell therapy will prove most effective?